started. Those of you who connected just now, please consider that our meeting, our conference is recorded and it will be available online on YouTube channel in open access. So if you wish to say something without recording, please tell us and we will have maybe a short discussion without recording in the end. And now I'm glad to announce the beginning of our next session of the conference Political and Economic Self-Constitution, Migration and Citizenship Education. Our next presenter is Stylianos Ioannis, Tzagkarakis, I'm sorry, University of Crete, Greece, and co-author is Stamatina, Douki, University of West Attica, also Greece. Stylianos will present the challenges for migrants during the pandemic and the necessity of the welfare state. This presentation is very well connected to our previous presentation and our previous discussion about health issues in citizenship education and about how health insurance and also access to health care should be taken into consideration regarding migrants. Stylianos, please, could you share your screen?
Thank you very much. Yes, I'm just sharing my screen. I don't know if you can see now.
Yes.
Okay, let me.
Would you try to change slides because sometimes we have problem with it?
Yes, now.
And yes, we see you're changing of slides.
So is it okay?
Yes, it's okay. You can start.
Okay. So thank you very much. Our presentation is about the challenges for immigrants during the pandemic and the necessity of the welfare state. So we can start saying that as this viral infection rapidly spread worldwide, vulnerable and marginalized population groups such as ethnic minorities, migrants, individuals with low income and low socioeconomic status appear to be disproportionately affected by the infectious spread of the disease. So the COVID-19 pandemic has revealed and amplified existing health inequalities among population groups within countries, which are long-term consequences of complex socioeconomic factors and with differences between the countries, of course. So we can say that at the global level, migrant workers have faced disproportionate social and economic impacts from the pandemic compared to the general population. At this point, and in order to further understand this form of social vulnerability to health threats, we could say that it is important to highlight on three key characteristics of refugees and migrants that make them vulnerable to respiratory diseases such as COVID-19. Firstly, their living conditions in overcrowded and unsanitary environments, or living with multiple individuals in shared accommodations, affect their ability to adhere to proper hand hygiene and hinder adequate ventilation of spaces and maintain appropriate physical distancing among themselves. Of course, their reduced access to healthcare services due to the lack of insurance coverage sometimes, and the lack of legal documents in the host country, and the fear of potential deportation. And the refugee and migrant population are constantly on the move until they reach their final destination. So this increases the likelihood of being exposed to respiratory viruses such as COVID-19. The International Labour Organization estimates that over 244 million migrants worldwide. There are about this number, and a significant number of these migrants are unskilled workers with low levels of education, residing in conditions of social overcrowding and inadequate hygiene, which raise particular concerns for public health. So although their housing conditions have generally improved over the years, globally, living conditions remain substandard in several countries, and this is a condition which amplifies their vulnerability during times of crisis. In Europe, thousands of migrants and refugees reside in densely population reception and hosting centers in the Mediterranean, for example, with insufficient medical and nursing staff and inadequate infrastructure in some cases. These centers often have limited shared toilets and reduced access to running water, leading to overcrowding that makes physical distancing impossible. These population groups, as they often struggle to comply with public health guidelines, may be more vulnerable to severe illness or death due to higher prevalence of underlying physical and mental comorbidities compared to the general population, and certain racial and ethnic minorities may have also limited access to basic diagnostic tests and treatments due to poverty, racial discrimination, language barriers, lack of healthcare system access, and lack of healthcare rights in hospitals. And this make them unable to adequately face problems of illness, and a problem of that is also COVID-19. So during the pandemic, migrant workers also in healthcare settings, primarily occupying positions as auxiliary healthcare workers and low-wage personnel, were found to be at an increased risk of exposure to the virus due to inadequate access to or improper use of personal protective equipment. This in the United States especially evident, but also in other countries. Other groups of migrants working in essential services under crowded conditions often continue to work while ill, either due to financial difficulties or workplace enforcement, and face the possibility of potential delays in seeking help when necessary, and increase the possibility of further transmission of the virus. The result of this is that several cases of COVID-19 were documented among migrants employed as workers in factories and in farms. So the generalized lockdowns across countries during the pandemic condemned certain categories of migrants and of workers migrants to inactivity, as they were unable to work or travel to their home countries. The situation worsened as some of them could not meet their daily needs due to economic constraints. Refugees, who often lack stable housing and employment, while frequently moved to avoid the risk of deportation, also had limited access to healthcare facilities. And these factors, combined with adverse living conditions, have increased their risk of exposure to infectious diseases and the transmission of illnesses. These are problems also evident in Europe. For example, in Sweden, which is considered as an example of welfare state effectiveness, refugees working in small businesses and the hospitality sector experience a deterioration in their living conditions, and we have an increase in the levels of poverty there. So also before the pandemic, only 30% of them were employed. In the United States and the United Kingdom, there has been a disproportionate mortality rate from COVID-19 among ethnic minority groups, with higher death rates observed among African Americans and Latinos compared to the white population. Specifically in New York, African Americans and Latinos had twice the likelihood of dying from the viral infection compared to whites of the same age group. Although these racial categories represent only 13% and 18% respectively of the population in the United States, they accounted for 21.8% and 33.8% respectively in the COVID-19 cases. In the United Kingdom, ethnic minority groups such as Black and Asian individuals were found to have increased chances of dying from the virus, with respective ratios of 1.7 and 1.6 compared to the white individuals of the same age group and with the same underlying conditions. In Greece, the European Committee for the Prevention of Torture and Inhuman or degrading treatment of punishment of the Council of Europe found that the hygiene conditions and provision of healthcare services in the refugee and migrant reception centers were inadequate even before the outbreak of the pandemic. There was a lack of healthcare professionals, of medical equipment, of translation services. So these key findings are corroborated by other studies in Greece, highlighting some of the protection gaps that became particularly evident during the pandemic regarding the healthcare coverage of vulnerable groups, such as refugees and migrants. So, so the COVID-19 pandemic, in addition to highlighting existing health inequalities, present a global challenge and an opportunity to address the underlying long-term determinants of these disparities. The challenges faced by migrants and refugees at socioeconomic level during the COVID-19 pandemic seem to trigger corresponding planning needs in political governance, both at national and international levels. The health of migrants and refugees is closely connected to the health of the host country's population and the sustainability of the healthcare systems, as well as the social security and the protection system. So it is a fact that these systems need to be organized and adapted to the changes in the environment in order to ensure the optimal level of social cohesion among divergent social groups with respect of the, for diversity and policies for the social integration of vulnerable groups. So systems need to be strengthened in terms of organization, for example, strengthen their primary healthcare, epidemiological surveillance, the management, the health management, and the holistic framework of prevention, promotion, treatment, and restoration in order to improve communication between migrants and healthcare professionals. There's a lack of communication, and also we have conducted research in the past, and we have seen that this lack may create a lot of problems in their health, also in addressing their health problems. So decision makers and
Я заебала, Слава, с твоей маленькой картошечкой.
Sorry? Decision makers and policy shapers in the field of health need, within an organized and inclusive welfare state, upholding the principles of the rule of law, equality, equity, citizens' freedom, are obliged to promote universal collaboration and coordination without exclusions, where all population groups will have equal access and rights to prevention, care, long-term care, restoration, monitoring. So otherwise, the welfare state fails to fulfill its fundamental purpose as it does not promote social cohesion. So this is the reason. So what we have learned from the pandemic period, that nothing is self-evident, but a welfare state which implements empirically based public policies, social policies, must be able to reduce the uncertainty, is the way to address efficiently and effectively these problems and to promote social inclusion. So thank you very much for your attention.
Thank you for your presentation. We will have questions in the end of the session after all presentations available in this session, because I don't see all presenters. But our next presenter is here, as far as I know. Marieli, Mezari here. Vitali, who is presenting in co-authorship with Andreia Isabel Giacomozzi from Federal University of Santa Catarina, Brazil, and they are co-author Mauro, Sarrica, Sapienza, University of Rome, Italy, and Raquel, Bohn, Bertoldo, Aix-Marseille, University, France. Marieli, you are welcome to share your screen, and I would like to remind other participants who are connected online, please check if your microphones are switched off when you don't talk.
Okay, my internet's not so good today. Can you hear me well?
Yes.
Okay, perfect. I will screen my presentation. If it is necessary, I can close my video to you hear me well.
For now, it is fine. Just I would like to ask you to change slides so that we can ensure that, yes, it works.
Perfect.
Yes, please start.
Thank you. So it's a pleasure to be here with you today. I'm Marieli. I'm a doctorate student from Brazil in co-tutoring with Sapienza, University of Home and the International Program and Social Representations. And I will present today the research Science in the Pandemic Context, interrelationships between politics, media, and common sense. Contextualizing the topic, the pandemic brought a new virus, often referred to as unknown enemy. Faced with the uncertainties generated, scientists started studying the disease, and political decisions were implemented with or without scientific basis in an attempt to reduce the virus transmission. It is important to say that the scientific community don't have civil responsibility for how the disseminated content is used by the governmental sphere. But throughout the pandemic, news about the number of cases and deaths circulated widely in different media vehicles, as well as information about protective measures and vaccine development, but distorted and or false information was shared and reached parts of the population before scientific information did. This scientific information, often complex, generated mistrust in the vaccine and in science itself. So traditionally, in the field of social representations theory, the distance between scientific and common sense forms of knowledge have been investigated, looking at the relationship between the verified and conceptual universes. However, many authors have underlined that this distinction is more hypothetical than effective, and that experts, specialists at the same time carry and are objects of representations. From this perspective, it is relevant to understand the important interplay between representations of science and common sense in a pandemic context. So this is a theoretical study and is part of my thesis project that investigates the debates around the science during the COVID-19 pandemic. This is in order to understand the existing literature on the topic, about this topic, the aim of this research that I'm presenting now is to take a self-reflective stance and explore whether and how social representations of science have been an object of investigation during the pandemic. So how was the research conducted? This is a qualitative research in a format of an integrative literature review. The search was conducted on May 4th in this current year, and across 6 scientific databases using the keyword social representations and science and pandemic. Initially, I read the titles and abstracts and excluding those that were not scientific articles, duplicated, a lot of unrelated to the topic, and not addressing science and not addressing pandemics. So this integrative to review included 39 articles that explored the relationship between.
I'm sorry. Could you please close the camera because the sound is getting worse?
Yes, of course. Sorry. Here. I think now it is better. Do you hear me? Is okay?
Yes.
Okay, thank you so much. So this integrative literature review included 39 articles from 45 different countries, and I did a thematic reflective analysis to analyze these articles. This is the distribution of article across the databases that I search. And what did we find in this research? The research identified the science as a focus or as a background with their respective subteams and their articulation throughout the media. The science as a focus corresponds to article that directly studies science in its various facets associated with the pandemic. In a crisis, scientists began to investigate the social, economic, cultural, and psychological phenomena and impacts associated with it. Science, so the science emerges in the antagonism between being portrayed as a heroine and a villain, being recognized or publicized as a savior through the studies to identify ways of protections against the virus and the production of vaccines. But on the other hand, science is also associated with conspiracy theories being seen as the villain responsible for creating the evil virus and its antidote, often linked to large companies for commercial purposes. The science is also cited as the foundation for informed decision-making in political and collective spheres. Regarding the political spheres, measures to reduce virus transmission are implemented based on indications or confirmations by scientific institutions or renowned scientists through the government. In the collective spheres, the public's trust in the scientific information they have access to influences the adoption of recommended protective measures, even though doubters are questioning about the effectiveness of such measures. For example, social distancing, mask wearing, or vaccines may circulate within the government. This science as background is not always directly mentioned, but is associated with the debate surrounding the pandemic. It is understood that scientific knowledge and common sense interrelate because science permeates society, becomes incorporated, and influences ways of life. Similarly, the social context is the basis for scientific development. So the mistrust arises in the relation to vaccines, which are products of scientific research and procedures that are part of social reality. Two factors are indicated as reasons for mistrust in science. The first one is that access to conspiracy theories, particularly regarding, the first reason for mistrust in science is the access to conspiracy theories, this is a very difficult word to me, particularly regarding vaccine production and the hidden agenda of pandemic and its cure circulating both in social and virtual realms. And the second reason for mistrust in science in these articles is the instance of healthcare professionals, such, for example, doctors and nurses, who are seen for the population as professionals with technical and scientific expertise due to their training, but take positions against vaccination. Depolarization stands out in the studies due to the uncertainty caused by a pandemic and the antagonism present in scientific and political spheres. Scientific polarization is highlighted by the varying efficacy of virus protection methods, such as social distancing and the use of surgical masks. We can reflect, of course, about the hydroxychloroquine, which was initially indicated as effective but later discouraged. The political polarization arises from the stances adopted by governments, with some countries following scientific guidance, while others contest scientific information, like Brazil, for example. This political and scientific polarization is identified as a factor that influences mistrust and fear in face of a health crisis. The social representations emerge in studies that investigate the social representations about the pandemic, the coronavirus, the social isolation or distancing, among other topics involved in the pandemic. The authors indicated the articulation of scientific information into representational elements that circulate among the population, primarily disseminated by the media. The articles discuss virus protection based on scientific recommendations and implemented through official public policies, but also examine the psychological, social, and economic consequences of these protective measures, particularly social distancing, which involved the closure of schools and business to reduce virus transmission and had important impacts on social and social health of the population. And we have the media. The media emerges in the studies that directly address science as focus or as background. Traditional and virtual media are indicated as important for scientific communication, serving as tools for effective health communication in crisis situations, as long as the information is reliable and up to date. The studies indicated that scientific information transmitted by the media can influence the adoption of protective measures by the population during a pandemic, as well as how the populations understand the situation, social representations. Furthermore, there are debates about how traditional media disseminates information, which can either downplay or amplify the severity of the pandemic context. The virtual media platforms are seen as a foundation for science because they allow scientists and policymakers to identify the beliefs and arguments of the population about certain topics and use them as guidance for health communication, taking into account prior knowledge. So it is possible to understand how social representations of science, politics, and common sense are in interaction and mediated by media communication. According to this review of the literature, science relates to the pandemic primarily through decision-making on effective forms of protection. Political decisions are based on shared scientific information, mainly through the media, but also through direct channels between scientific committees and governments. The science relates to Science is related to common sense and collective decisions influenced by scientific information received through media and our government communication, affecting understanding of the situation, beliefs, and attitudes towards the pandemic. And in this context, it was identified that science can be seen as reliable and safer, or the cause and face of a health crisis at a pandemic level. And in the end, traditional and virtual media play an important role as intermediaries in scientific communication, political decisions, and the population disseminate information that may or may not become part of representational systems and the complexity of the pandemic. I'm sorry for speak so fast, but this is my references. This is the integrative review references, the 39 articles. Thank you so much. And I'm sorry for my internet connection is not very good. I hope you can hear me.
Thank you, Marieli, for your presentation. It was wonderful. And is anybody from this session also connected now? Vaiva is not connected now, as I see. Dileta? Dileta, your microphone is off. Could you turn on your microphone? No, your microphone is off. We can't hear you. I don't know why.
I'm sorry, do you hear me now?
Yes, we hear you now.
Oh, thank goodness. I'm going to speak on behalf of Vaiva Zuzevičiūtė, the first speaker of our singular presentation. Can I? Is it my turn?
Just a moment. I have a suggestion. As it is 1 o'clock now, would you prefer to have one more presentation and then go to lunch, or we can start our lunch break now and then have another session? How would you prefer to do it? Because it's already 1 o'clock.
I know, but the problem that we busy go still go on.
And then we start in 2.
Yes, sorry, just to say, we have Dileta here, okay, so then we have Oksana here.
Oksana is not here.
He's not here. And Andreia is here, Mexico, is Andreia here?
I don't see Adrian.
Okay, so we have only Dileta and Vaiva.
Excuse me, I have difficulty hearing, so could I start?
Yes, please start your presentation, and then we will, after your presentation, we will have discussion, questions and discussions of the whole session, and then we will have lunch break.
Okay. So I have somehow to adjust my screen. Yes, so that to share it with you. Okay, here it is. Do you see my screen?
Yes, we can.
But please,
okay.
Please try to change slides so that we see that it works.
Okay, sorry, I will just soon adjust my first one. So, ladies and gentlemen, my name is Dileta and represent Vilnius University, and my colleague, Professor Vaiva Zuzevičiūtė. And today I'm going to make this presentation for she has had some of the issues that she couldn't come here, but she told me to send you best regards and her appreciation and excuses that she can't participate her in person, but nevertheless I wouldn't like to disappoint you, so I am going to get this presentation so that you couldn't feel bad instead of her hearing me. Well, first of all, I want to say that most people understand intercultural communication and its importance as taking place only when international cultures meet. But that's not the case of all. All everyday interactions are examples of intercultural communication where everyone comes from different contexts while having a different perception of nationality and cultural context. So first of all, the aim of the research, the aim of the presentation and presenting the theoretical considerations regarding the concept of intercultural competence and its interpretation by theoreticians. I'm also going to speak about the first results of a pilot study where Estonian and Lithuanian students share the point of view on the concept and the possible interpretations that have taken place. Notwithstanding the limitation of a study, which stem from the fact that just a few dozens of participants share their point of view, most of them, of course, anonymously, but the analysis of results revealed certain trends that seem to be worth further investigation, especially in the light of changes in the world. we have applied critical analysis of reference, theoretical considerations, reflection on personal experience, and a pilot empirical study involving respondents, students in Lithuania and Estonia, who were employed for the development of the presentation. So we used this method so that to design this presentation based on the research. So students from Lithuania and Estonia participated in this piloting research. Intercultural competence, straightforward or controversial. So while we still believe in the importance of intercultural competence for every citizen of a global world or dissident, and especially a professional such as a pedagogue, a law enforcement officer. However, in the light of recent events and changing geopolitical context, we think that the deliberations should be renewed. So our attitude should be changed. Our way of thinking and the logics of the research are organized along the arguments about what is straightforward and what may pose certain controversy, what intercultural competence is analyzed. Several influential models of intercultural competence were offered, with the one offered by Deerdorf, almost 20 years, who is in charge of designing and working in this field. And he has designed this module that comprises 3 dimensions: knowledge and comprehension, skills, attitudes, and some of the minor important elements. So knowledge and competence, skills and attitudes are the most important ones. He considers knowledge and comprehension including all cultural self-awareness, deep cultural knowledge, and of course based on social linguistic awareness. Skill, according to him, encompasses ability to listen, observe, evaluate, analyze, interpret, and relate. Meanwhile, attitudes encompass respect, valuating other cultures, openness, withholding judgment, curiosity, and discovery. In other words, tolerating ambiguity. Another influential model was offered by Bennett. So according to this model, we have the 3 aspects that encompass cognitive dimension. Here we have cultural self-awareness, cultural general knowledge, cultural specific knowledge, and cultural adaptation process. The other one element, behavioral dimension, encompasses ability to emphasize, to listen and gather appropriate information, the ability to manage relationship and to manage social interaction and anxiety. What concerns affective dimensional, it encompasses curiosity, initiative, risk-taking, suspension of judgment, cognitive flexibility, tolerance of ambiguity, and of course, cultural humility. We have got the other evident difference, such as emphasis on linguistic competence in Deerdorf's model. While in Bennett's model, we understand that he emphasizes only the relations. However, the 2 models have many similarities. For example, the knowledge about and the competence that may clearly identify such components and elements as withholding judgments, tolerating ambiguity, which are very important. So they emphasize that both of them emphasize the importance of these 2 segments that are part of the above models. It is important also to note that the subsequent analysis of the models and their translation into the professional's life in Lithuanian context revealed that the most demanding and the least automatic is the behavioral aspect of intercultural competence. That is, when we learn about other people and their cultures, and even if we consciously understand certain characteristics of their culture, we make such a consideration that we wonder about them. In other words, to behave in an adequate and contextual way may be most demanding. You understand that the context that has become different and because of the political situation that we have in Europe, for example, so the transformation of intercultural competence has also transformed. So it is being in progress, and moreover, the attitude towards this process has also been changed at the moment. So pilot empirical study could be interesting for the reason that it examined the role of intercultural competence, which resonates with the future law enforcement officers. And a pilot study was defined and implemented during the last quarter of 2022 and the first quarter of 2023. So totally 106 students, future law enforcement officers from Lithuania and Estonia, shared their opinion, as I have mentioned, in an anonymous questionnaire where they were asked to choose the statement that they agreed with most. So you can see that opinion in the picture, right? And you will note, please do notice that the opinions differ. And if we take, for instance, Lithuanian students, their opinion is absolutely opposite. So in most of the cases, we see that the respondents you see answered this question, and it shows that different opinion. So here we have Estonian respondents, right? And that's the difference. So for example, among the Lithuanian students, nobody mentioned that it was not an important intercultural competence for them. But for some of the Estonian students, as you can see, 1% shows that it was absolutely not important for them. Instead of conclusions, what I want you to say that straightforward aspects of role of intercultural competence, or at least admitting its place among the professional competences, may serve as a strong marker regarding society's genuine maturity, level, respect for human rights. And these aspects illustrate positive and desirable role of intercultural competence, which plays in professional law enforcement officers' activities. The controversies related to intercultural competences are linked to situations where the balance between sensitivity to intercultural aspects of contemporary living are very much involved with upholding the supremacy of law that maintain in order to secure the general cohesiveness of cohabitation and the implementation of law enforcement for the general state of security with a given society. The pilot empirical study, notwithstanding its limitations, we do agree that we still have to continue working on this research and continue questionnaire students, not only from Lithuania and Estonia, but we hope that we have some of the students from the other countries that would join and that they would participate in it and would help us develop better the intercultural competences and the attitude to the changing situation. So as I have mentioned, the pilot empirical study, notwithstanding its limitations, show young people in two countries having different point of view regarding this first choices. And there are also differences regarding other choices. And that's why what we want to say, we need the other country students' opinion working in the law enforcement environment so that they would also show the way they develop their intercultural competences, though they, as I have mentioned, they have changed a little bit their attitude and due to the circumstances that we all know that is underway in the Europe and other geopolitical situation. So that concludes my presentation, and I understand that my colleague would more profoundly answer your questions, but if I could help, because I participated in this project, could be in handy. Yes, to discuss these competences and what you have engrossed with your law enforcement students. So thank you so much. That concludes my presentation. And sorry, I have to return. Yes, sorry. I want to stop sharing, stop share. Okay, so thank you for your attention. Yes, so if you have any questions, I would answer them with pleasure, but if you're not, because I'm sure that you are eager to go for lunch, right?
But we are also eager to have discussion. So we had, in my opinion, quite an interesting session. We started from pandemics and access of migrants to health care. And as pandemics finished officially,
We have got another problem.
yes, we will talk about another problem a bit later. And also in our session, we had concluding presentation regarding intercultural competences. And now I would like to invite discussion. I am especially interested to listen to Bohn and to Zuzevičiūtė. I remember from our previous political and economic self-constitution meetings that Bohn also studied public opinion on pandemics and media representation of this topic. Probably Bohn and Zuzevičiūtė has some comments regarding our two first presentations. And then we will move to the last valuable presentation about intercultural competences.
Well, thanks for inviting me in person to comment. I did some studies on that topic, but on a bit related issues. We didn't study media per se, but we studied what media are consumed by individuals in the public opinion and how that is related to various attitudes. In Serbia, media are very polarized, so it was very clear. Attitudes were clearly connected to specific media outlets. But I would just first like to start with the second presentation about the sciences. I was wondering whether some distinction between social sciences and natural sciences appeared there when you analyze this literature, because often at least sometimes in public opinion, you could notice that people perceive it differently. Like there is a perception that the natural sciences are more objective and that social sciences are not really sciences, that they are often political and so on. So that would be my question for the beginning.
It is for me, right?
Yep.
Okay, so in this integrative review,
maybe if you stop transmitting video, we will hear you better. We can't hear you very well. If you close camera, we will hear you better.
Okay, I'm so sorry. My internet connection is horrible.
Depend on us.
So in this integrative review, there are a lot of studies that focus on natural science. And in this review, I didn't the distinction about social natural science, but it is a very important thing that I'm doing in my thesis project. This distinction of the origin of science. It is social, if natural, if economic, political science. It is not appears in the integrative review, this distinction. But I really wanted to focus on this distinction in my thesis. So I don't know how I can answer your question more deeper, because I didn't do this distinction in this research. I'm so sorry.
Yeah, thanks. Yeah, I was wondering just about some impression while reading the articles.
Yes.
Okay. Well, about the migrants, I mean, it's extremely important topic, and it's great that we have researchers dealing with it, because in many places they were just forgotten. Like during COVID in Serbia, for instance, it was as if we are not transitory country, as we didn't have a big influx, and a bit reduced, but still. So I was wondering if you had some examples where countries had particularly good and successful policies in to not leave them behind in this difficult situation.
This question is for me.
Yeah. For you.
Yeah. Okay. Thank you very much. Well, good practices. There are some countries which have also reacted very well, and there are the countries which have more developed, let's say, healthcare system and the welfare state per se. I mean, you can see there higher percentages of inclusion, and then higher percentages of successfully dealing with such problems. For example, in the Scandinavian cases, even though there are some problems, we can see, if we compare the data, we can see that they more effectively dealt with the issue. There are some countries, for example, which have historically higher inequality, and this is, for example, the United States. So there we can see they historically have problems with equal access, of course, unequal access to healthcare. So there we can see the difficulties during the pandemic for the migrants, for the people from other communities. Yeah, there are some good practices, for example, in Denmark. But at the same time, these are the different levels. Doesn't mean that they face all the problems, because of course, when you have a pandemic, it's an extreme situation. You cannot face all the problems successfully. And just to say another comment, well, the pandemics have not finished yet. Well, they have not finished at all. I mean, they existed throughout history. They will come again, and also the health problems exist, especially for people, for marginalized people such as migrants. So this is the challenge here for the welfare states and for the health systems. What they have learned, what is the capacity learning from the pandemic, from the recent pandemic. So for some countries, well, they have developed the systems before, and they are better dealing with these issues. For example, in Northern Europe. For some other countries, this was not like a lesson. We can see that, and we can see that if we compare the data for the access of the healthcare in Greece, for example, the inequalities that exist, and this is especially increased for the marginalized, for the vulnerable groups, etc. So thanks.
Thanks. I would now let other people join the discussions, not to privatize it.
I'm absolutely agree that this pandemic is officially over, but humanity is going to face other pandemics. It was predicted by scientists a long time ago, and we just need to learn how to deal with such challenges. And these challenges, this crisis, pandemic crisis, now and further on, they can be overlapped with other crises, one of which we have in Ukraine now, the war in Ukraine, and many Ukrainians are going to Europe, and I am one of them. And not only to Europe, but also to Turkey, to ex-Yugoslavian countries. All these crises are going to be overlapped, and how humanity will deal with that, somehow it will be managed, and I hope we are not going to encounter nuclear challenges. I hope humanity will be able to yes, to miss this challenge. And I hope this challenge will never happen. My suggestion is maybe we can talk a little bit more, but we can start next session at 2:30.
Okay.
My suggestion is to do this way because I see that many participants are here now, and the discussion can be interesting. So if somebody has something to say, please, I invite you for discussion. I see that Alexander Yankovich is also here now. Do we have any more questions? As I see, our last presenter is not longer connected. Yes. She's not connected anymore. Yes, Alexander didn't hear us.
Okay. Please repeat next session time. And that we're going to include this share.
I would like to stop recording now. I would like to acknowledge our presenters for this fruitful discussion, and to acknowledge everybody for connecting now. And now I'm closing the recording.